Hello everyone, welcome to my channel, Nursing Made Easy. The goal of this channel for now is to present material that's crucial for doing well on the Nclex. This is the first of many videos that I'll be making, and I'll try to focus on content that's likely to be tested on the Nclex, and I'll try to keep the content focused on what you absolutely need to know without adding too much fluff. Just a quick background on myself. I wrote the Nclex on October 11, 2022, and I passed it in 75 questions. If you guys like, I can make a separate video on how I prepared, what resources I used, and other tips for the days leading up to the exam as well as during the exam. So comment if you guys would like that and let me know. Now, without further ado, let's begin our first lecture where I'll be focusing on lab values that you should know for the Nclex. Now, the first thing you'll notice is that I didn't include the units for a lot of these values throughout the lecture, and that's because you don't really need to know the units for these lab values for Nclex. So we'll start with the metabolic panel. So sodium is 135 to 145, potassium is 3.5 to 5.0, magnesium is 1.5 to 2.5, phosphorus is 2.4 to 4.4, calcium is 8.6 to 10.2, and glucose is 70 to 100. Now for normal clients, if a client is on TPN and their glucose is around 140 to 180, that is fine. And also for hospitalized or critically ill clients, if their glucose level is less than 180, that is fine as well. So for the lipid panel, these are the normal values. So for HDL, it should be more than 40. LDL should be less than 100. Triglycerides should be less than 150, and total cholesterol less than 200. Now, these values are applicable for something you might see on the Nclex called metabolic syndrome. And this is the presence of 3 or more metabolic health factors that increase a client's risk for stroke, diabetes, or cardiovascular disease. So this is the criteria you use to diagnose metabolic syndrome. So if for waist circumference, if it's more than 40 inches for men and more than 35 inches for women, or if they're receiving treatment for reduced HDL, if their blood pressure is higher than 130/85, or if they're receiving drug treatment for hypertension, their triglycerides are over 150, or they're receiving drug treatment for high triglycerides, if the HDL is less than 40 for men and less than 50 for women, or drug treatment for hyperlipidemia, and if their glucose is over 100, or they're receiving drug treatment for hyperglycemia. So that's if there's three of these present or more, they would have metabolic syndrome. So for renal function, you need to know BUN, creatinine, and urine-specific gravity. So if there's any kind of kidney dysfunction, these values would be elevated, or for example, if a person's dehydrated, the urine-specific gravity would be higher. So BUN is 6 to 20 normally, creatinine is 0.6 to 1.3, and urine-specific gravity is 1.003 to 1.03. For liver function, some of the important values you need to know is albumin, prealbumin, and ammonia. So albumin is 3.5 to 5.0. You'll notice this is the same as potassium. Prealbumin is 16 to 35, and ammonia is 15 to 45. You won't really be tested on prealbumin necessarily, but I included this because of one particular scenario that pertains to malnourishment. So if someone is malnourished and they have a deficiency in protein, if you're given a choice between choosing which would be a better indicator for malnourishment between albumin and prealbumin, you would choose prealbumin. And this is because albumin has a serum half-life of a few weeks, but prealbumin's half-life is a lot shorter. So if someone is malnourished, their serum albumin levels can still be in the normal range, whereas their prealbumin would be lower. So you would use prealbumin as the better indicator. So for heart function, these are the values that you should know. It's a good idea to know troponin I and T, but you definitely should remember BNP. So troponin I and is normally less than 0.5 and troponin T is less than 0.1 normally. Elevated levels of these indicates cardiac muscle damage, such as in the case of myocardial infarction. And BNP elevates due to cardiac ventricular stretch. So this happens, for example, in heart failure, if the ventricles are stretching due to fluid overload, then this value would be elevated in proportion to how much the ventricles are stretching. For all these values that I'm discussing, I will go more in depth of why these values are relevant and for what these values are relevant when I'm discussing different systems in subsequent videos. But for now, I just want to present the values that you should know. Okay, so for a complete blood count, hemoglobin is in general around 12 to 18 normally. I listed these specific values for you to know if you want, but I would personally just know 12 to 18. Hematocrit is just hemoglobin multiplied by 3, so normally around 36 to 54%. Red blood cells are 4 to 6 million normally. White blood cell count is 4,000 to 11,000, whereas absolute neutrophil count is 2,200 to 7,700, and less than 500 is severe neutropenia. Okay, coagulation studies. This is very important because a lot of questions pertain to these, so knowing these is very important. APTT is around 25 to 35, INR is 0.75 to 1.25, and PT is 11 to 16 seconds. APTT is used when clients are on heparin, and the APTT value for these clients should be 46 to 70 seconds. So when someone is on heparin, their APTT values normally should be 1.5 to 2 times the normal value. INR and PT is used for clients on warfarin. So this is what you're monitoring when someone's on warfarin. And the values, again, should be 1.5 to 2 times the normal value for clients on warfarin. And for these clients, INR is usually around 2 to 3. But for clients with mechanical heart valves, the INR value, the therapeutic range can be between 2.5 to 3.5. So for these clients, this is normal and this is therapeutic. Now, another thing I want to quickly add, but I will go over this again on later lectures. So for someone on heparin, if the APTT value is higher than 70 seconds, for example, if the APTT is 100, this client is at risk for bleeding, and the antidote for heparin is protamine sulfate. In the case of warfarin, if the INR and PT values are very high, for example, around 5, the antidote for warfarin would be vitamin K. Here are some of the hemodynamic parameters, which is a good idea for you to know. So cardiac output normally is 4 to 8 liters per minute, and this indicates cardiac function. Central venous pressure is 2 to 8, and this indicates fluid volume status. So in the case of heart failure, you may see CVPs that are elevated, and this basically means there's a heart failure exacerbation because the client is experiencing fluid volume overload. Pulmonary artery wedge pressure is 6 to 12, and this indicates left-sided heart function, and specifically left ventricular preload. So this may also be elevated in the case of heart failure. Mean arterial pressure is 70 to 105, and you need at least 60 to perfuse vital organs. So as you guys know, the formula for calculating MAP is systolic plus 2 times systolic pressure divided by 3, and this indicates perfusion of organs and tissues. And systemic vascular resistance is 800 to 1200, and this is the force exerted on circulating blood by the body's vasculature. Okay, lastly, I want to go over the ABG values. So pH normally is 7.35 to 7.45. Bicarbonate is 22 to 26. PaO2 is 80 to 100, PaCO2 is 35 to 45, and SaO2 is 95 to 99%. If someone is experiencing acute respiratory failure, their PaO2 will be less than 60, or PaCO2 it would be over 50. Now, when it comes to ABGs, there's an easy way to remember whether someone is experiencing metabolic acidosis or alkalosis or respiratory acidosis or alkalosis. So acidosis, you look at the pH. So if it's less than 7.35, it's acidosis. If it's over 7.45, it's alkalosis. And for differentiating metabolic versus respiratory, you just look at the pH and HCO3 values. So if pH and HCO3s are trending in the same direction, so whether it's up or down, it will be metabolic. So if the pH is less than 7.35 and both the pH and HCO3 are below their normal values, so they went down in the same direction, it would be metabolic acidosis. Whereas if the pH was over 7.45 and the HCO3 was also above 26, then both these values went up, so it would be metabolic alkalosis. For if the pH and HCO3 are trending in the opposite directions, or only one value is going up or down. So for example, one value may be below the normal or above the normal, whereas the other value is within the normal range, then this would count as respiratory. So if pH was 7.3 and HCO3 was 24, for example, that would be respiratory acidosis. Similarly, if pH was 7.5 and HCO3 was 20, that would be respiratory alkalosis. So that concludes this video. These are basically most of the values, if not all the values that you need to know for the Nclex. I'll be covering other systems in subsequent videos. I hope this video helped you guys. Please like and subscribe, and see you in the next video. Bye-bye.